All right, I'm going to be sitting down for this little bit here. So again, in an effort to just keep the content varied and interesting and topical and useful, I thought I would share with you this Team Care clinic budgeting tool. So if we think about our chronic disease services and any kind of nurse clinic component, one of the key challenges is always, well, what do the numbers look like? How do we actually make the workflows financially viable? How does it all actually work together? Sometimes you might be asked to provide a business case for a new model of care that you might want to put together. So this has been a bit of an ongoing challenge for a little while, and this is the outcome of some of that thinking and mathematics behind how you can model a nurse-led clinic and have some reasonable confidence about the viability of the services that you're going to provide. So this tool, you'll see on your agenda there is a URL link, and when you get back to your practice, you can go to that link and you can download this tool and you can use that within your practice free of charge. So I want to run through it so that you're comfortable with using it, and certainly if you've got any questions after this, you can contact me at any time. So in essence, what this is about is ultimately coming up with a Team Care clinic budget that is not in the negative, that is not going to cause further financial strife to your organisation. And the way it works is it looks at both the income, the revenue that you might generate through the activities that you do, as well as the expenses that are associated with that particular activity as well. So there are going to be both recurring revenue and recurring expenditure, as well as sometimes one-off income and one-off expenses as well. So this little tool will take all of that into account, and you can also introduce your own unique item numbers or services that you want to model, and how might that look if we provide that. So I'm going to run you through the key elements of this particular tool. It's an Excel spreadsheet, so it's reasonably simple, and so we'll run through there. So in terms of having a look at the revenue or income that a nurse clinic service might generate, usually that will still be based on your Medicare benefit schedule items. So whether it is about care planning or health assessments or the like, usually the key revenue items are still related to that. And that's the core focus for this as well. So if you have a look down this list here, you'll see the common item numbers that you are very likely recognizing there. Can you see those numbers okay? Does that need to be bigger? Let me just...
Probably could be bigger.
Yeah.
But now the screen is a bit skewed. That's right.
Yep, so there we go. So this is on the income side. You'll see this is just some dummy modelling, so this is not sort of representing anything real. The spreadsheet is locked down so that you can only play with the shaded fields. So you'll see that I can click into the various fields that are shaded, but I can't click into the white areas or the areas that have important numbers in there that we don't want you to be able to wipe out. So before we start going into that modelling, I just do want to emphasise that whenever you're doing this modelling, you need to make sure that if you're going to be counting GP management plans or team care arrangements or anything like that, that our presumption is that you will be compliant with Medicare in the use of those items. So this is just about using the revenue that comes out of that and seeing what the outcome will be. So for our pretend clinic here, we have determined that a clinic may consist of 3 GP management plans, 2 team care arrangements, a couple of GP/MP reviews, and the same number of team care arrangement reviews. So again, these are numbers that you can play with. You can make them look like anything at all. In terms of what is a clinic, what is a session, that is entirely up to you to decide. So a clinic could be one patient. It could be, well, what does that look like if the nurse does this component and the GP does something else? What does that outcome look like? So a clinic could be one patient. It could be a couple of hours. So you might say, well, our nurse has 1 hour or 2 hours to spare on a Wednesday morning. What are the activities that are undertaken within that clinic and how does that translate? Or a clinic could be a whole day, or it could be a whole week. So what you call a clinic is absolutely flexible. So just keep that in mind, that that you think about how it applies to your specific circumstance, and this has the flexibility to deal with all of this. So if we consider, for example, a half-day clinic, and we're going to undertake a number of activities, what you've got here is an estimation of how many patients you might see for the session, for the hours that you've determined that you've got available. So in this example, we've put down 3 GP management plans, a couple of TCAs and the like. We've now given you some estimates of how long a nurse component might be in undertaking those activities. So you'll see that you can't click into those fields. These are just recommended time frames that will help you decide whether that's right for you or whether you want to tweak that a little bit. So what we're saying here is that a GP management plan for a nurse, probably a good time to spend on that might be 45 minutes. And if you're going to see 3 patients, that's going to add to a total of 135 minutes. In the next column, you're able to modify that. So in this circumstance, we might say, well, most of our GP management plans are combined with team care arrangements, and for the totality of that, we want that to be 60 minutes. So you can see in here, we've turned a 45-minute recommendation into a 60-minute time slot, and we've also amended a team care arrangement that is ostensibly 15 minutes, and we've now said, no, we'll count that as 0 time because we've counted that in as part of that GP management plan. Again, we could leave it alone and say, well, yeah, I'm happy with 15 minutes for a team care arrangement as well. And it will just continue to add the time, the number of minutes that each of those components is going to take for your session. And again, this will become a little bit clearer once we scroll further down on this sheet. So what happens further along in terms of the revenue side is that the Medicare rebates are stipulated there, and they're up to date. And if we've said that in our session we're going to do 3 GP management plans, that will be a total revenue of $439.65. So it's a simple multiplication exercise. Whenever you modify the field here, it will affect the dollar column on the right, and so on. So you'll see as part of I need to scroll that down this way. As part of this spreadsheet, you can put in all of the item numbers that are applicable to the service. So you can see the heart health assessment is there, the normal health assessments are there with recommendations for time. There is the Aboriginal Torres Strait Islander health assessment. You will see the diabetes cycle of care levels B, C, D, and asthma cycle of cares are still in there as well. I'll have a little bit more to say about that in a moment, and a few other items there as well. So you can model that according to what you are wanting to get some predictive revenue on. There are some fields here where you can put in your own components here as well. So these are shaded areas. You can put in your own component. You can say how many services of those you're going to provide and how long do those services take. Whatever that might be, you then also need to say, well, is there any revenue associated with that particular service? If it is, go back on that. If that is, go back up. It doesn't like that field. let's say $30 or $20 for that, then you can see that 4 services of $20 is going to give you a revenue of $80 in there. Then there is a field a little bit further down that is for nurse-only items, and the differentiating factor between the 2 lines up the top and the further lines down the bottom is when we are estimating the costs associated with your clinic. If you have some nurse-only items, then it's going to exclude that revenue from the estimation of the cost of your GP take on or take off from that clinic activity. So it's just that segregation of saying, well, there are some nurse activities and the GP is not entitled to any income from that. So that's the differentiating factor between these lines here and the further nurse-only items down the bottom here.
So, because these are WIP items, the workplace incentive
Yes.
payment
Yep.
eligible, how can we identify the value in that financial contribution? So
Okay, there's a couple of different ways that you can do that. So just bear with me, and we'll get to that. So once we've factored in the activities that we're going to undertake, you'll see it's added up the column to show that this particular clinic, the revenue generated for the attendance items is just under $1,300 there. So we can then also look at the estimated nursing time versus what you have specified it's going to take. So this shows you now that we're talking about an almost sort of 6-hour clinic that we're working on. And the comparison of your numbers versus a recommendation is just simply to say if there is a very big differential there, you might just want to go back and check that how long you think it's going to take is realistic and effective. And these numbers are also used in estimating the cost of your nursing wages in this clinic as well. So then there are some other revenue items that you might want to include in there. So for example, the practice nurse incentive payment, you might want to just say give a dollar allocation to say, well, we get X amount of PNIP. We might say as a round figure, we're going to allocate 2 items of $20 from PNIP to factor into our modelling for this. If you say, well, no, our PNIP is actually taken up in other areas, then you might leave that blank altogether, and say.
Hasn't the PNIP included in July, and we're now on WIP, WIP?
WIP actually starts next year.
Does it?
Yeah.
Right.
Yeah. Yeah.
I thought it
Yeah.
already kicked in.
Yeah. So really, whether you call it WIP or whether you call it PNIP, we're kind of talking about a dollar allocation from one of those buckets. Now the new one here too is the QI PIP. So of course you guys are all participating in the quality improvement practice incentive program, I would imagine, and you can do some modelling around that as well. So what that looks like is down the bottom here, there is a separate little calculator with an explainer as well that shows you using your practice incentive payment statement, you will get information from there that will help you to work out what you want to allocate to your clinic. So in this example, your practice's SWIPI, the standardised whole patient equivalent, is 3,100, which means that the QI PIP revenue calculated per year is going to be $15,500 on those SWIPIs. You would, as rural practices, get a rural loading in here as well. So you would put that in there, depending on what your rural loading might be. You might get an additional payment as part of that. So it shows what your total annual QI PIP payment is going to be. then that is divided out to give you, what does that look like on a week basis? Because that's a number that's much easier to work with than an annual amount, which shows it to be just over $400 per week. And then you might say, well, okay, well, out of that $400, let's take $80 to apply to this modelling work. And this is a free text field, so this is just saying plug in your numbers and then make your decision about where you want to play. And so again, depending on how your numbers work out, ultimately you can up it a bit, you can reduce it a bit, and it becomes your budgeting model for how that might look. So if we leave that at 80, and you'll see there's a whole lot of blurb there to explain how you need to use that, that is automatically, this field here is automatically brought back into the calculation field up the top here. Okay, so they're automatically linked. And so then taking into consideration the PNIP and the QI PIP revenue that you want to include, we now say we've got an income per session of say $1,370. Then lastly, you might want to include any one-off type of income. So for example, if you're participating in this type of project work where you get some funding from the PHN to undertake some specific work, you might say, well, okay, we've also got some additional revenue that we might put in there as well. It might be $500, it might be more, it might be less. So you can include that as well, and that will again influence the overall outcome of your budgeting. For this purpose, I'm not used to this computer, I'll just delete that back out. Delete, there we go. So that's the revenue side of the calculator. And we can then start to have a look at the expenses that are going to be associated with this. So from the bottom of the sheet here, where we had estimated the time that our nursing clinic is going to take, these numbers are reflected back up here. So the total suggested time of 5.9, your allocated time is 6.9. That will help you to work out your staffing costs associated with this clinic. Now, of course, the biggest expenditure associated with this type of work is going to be the percentage that your GP is going to be entitled to. For the purposes of the modelling, what you need to put in here, and you may need to speak to your practice manager, of course, to work out what that's going to look like. It could be something like 60% or 70% or thereabouts, or it could be less. And again, playing around with this is going to give you that impetus to say, well, if we normally pay our doctors 70% of the revenue generated, oh my gosh, my clinic is not going to be viable. But if we bring it back down to maybe 50% or 55%, we're at least at a break-even position. So this tool is designed to be a conversation starter about how it might work. So you can put into the session here as well, or into the expenses, that if you run the nurse only clinic with no GP input, you can determine the value from the income section and exclude that from the payment to the GPs. Now, we didn't have any in the income estimation, so it isn't going to be reflected here, but if you did, it would pop up into there. So what we can do then as well is, for example, here we're now looking at the staffing costs associated with it. So you'll see too here that once we've put in the GP's percentage of that revenue generated, you'll see it has automatically, populated the total amount of fees that your GP is going to receive. If we bring this down to say 50%, you can see it's brought that amount down to $646. So that's how that calculation all fits together. Then using the time of your clinic, what are the actual hours that you are spending, you can say, well, if our nurse is spending, say 6 hours on the clinic, we might expect there to be 2 hours of admin time that we need to factor in there as well. So you put in your 2 hours, you then need to specify what the hourly rate is that your admin costs need to reflect. And there's a little prompter there to say, when you think of the hourly rate, you need to think of that as the marked up version. So it needs to include superannuation, it needs to include leave entitlements. So the hourly rate is not the rate that your staff member gets paid, but what it translates out to when you include all of those on costs as well, because that's a far more realistic estimate of the true viability of this. In this particular example then too, I've got 5 hours here for the nurse cost per session, but we already know now that it's looking much higher than that. So we would probably now change that to maybe 6 or even 6.5 to say we're doing 6.5 hours of nursing time. We've calculated that at $47 an hour, again using that same methodology of marking that up to include all of the on costs. And we can then see that we've got that recurring cost per session. So we've got our revenue now, we've got that recurring cost as well. And then when you're just starting a new clinic, you may have some startup costs that are not recurring. So it might be about marketing, it might be about purchasing some new equipment, it might be about some of your staff training, meetings that you need to hold, or some resources that you want to develop. Or there could be anything else. So there is another sort of free text box there where you can include anything else that you would want to include as that one-off cost there. So then we've got that total for the non-recurring costs there as well, 550. So we've now got a rounded input of all of the expected income and expenditure. And when you've gone through that thinking exercise and played with those numbers, you can tell that I have a Mac machine, can't you? Because the mouse works very differently here to my own laptop. So now we get to the moment of truth in terms of is our clinic going to work well or not? Now the last input item here is the number of sessions that you're planning to do. So in here we've got, if we run 10 sessions with this kind of activity and that kind of expenditure, we're going to see a profitability for the practice out of that of about $2,900. So that's pretty okay. I'm not saying that this is a realistic example, but that's what these numbers are showing you. If we change this and said, well, if we do this as a one-off clinic, what would happen here? So we're now seeing that if we just do this once, because of the non-recurring income and the non-recurring expenditure that you need to factor in as well, you can see that if you only do it once, you're going to be running at a little bit of a loss. If you run 5 of these clinics, it's looking a little bit better. And of course, the more clinics you're going to run, the better that outcome is going to look. So in a nutshell, that's how this little planning spreadsheet works. Do you see this as being useful in...
That's the profit you make once you pay the GP.
Correct, yes. So that's the bottom line of when everything's been paid out, you've taken into consideration your wages for your GPs or the percentage takings for your GPs, as well as your admin costs, as well as your nursing costs, then you will see the outcome of that. But that presumes that the items that you are running are fully billed, so you complete all of the activities that you are modelling. It's done in a compliant fashion and you don't have no-shows. So I guess you need to think about, well, what are the impacts of patients not attending, or is this a realistic model for the type of activity that we can do? if you use this and say, look, here is a bit of modelling, you can print this off and save it as different spreadsheets to say, if we do this, this is the outcome. If we do that, that is the outcome. Like I said, it starts the conversation, and then you might start to implement your work and then plug in the actual figures that you've seen to say, did we get that right? Did we not get it right? But it is just starting from a baseline that you can tweak over time. So obviously, I'm not responsible for how many items you're choosing to undertake or how realistic that is, but it just gives you that framework to start the thinking and start the modelling and build a business case for some activities. And look, what I would say, and it is definitely controversial, you'll see that profitability here is looking really not too bad. And you know, we all know that the finances within practices are pretty constrained. But have a look at this. This is with your GPs earning 50% of that recurring item. If you apply the 70% methodology, you can see what a difference that makes. So if we are doing 5 sessions, you are still running at a loss when you're paying your GPs at that level. So again, it's about the conversation started to say, well, if we have viable services going forward, we really need to be looking at that distribution model as the single biggest item that's going to affect the viability of that service. And again, it is provocative. It is quite different to the way that many practices do run these services. But I do know that, you know, having done this within my own practices as well, that it is possible with the right information to actually show it. So doing this from a gut feel is just too loose. So again, like anything, you need data to show you what's really going on. So this probably fits your gut feel already a whole lot better than than the 50%. But it is showing you where does it sit at, and this is just a simple tool to help you get that clarity around what can we do, what should we do, is it worthwhile. So this is a freebie tool for you to use, and yeah. Yes, it is. So I would say if you're working with that PNIP, the QIPIP amount, what you really need is your Pip statement. So depending on what your role is within the practice, if you've frequently looked at Pip statements, then you will know where to find that information. If it's not something that you look at frequently, go have a talk to your practice manager. You might need to ask them for a copy of this, and you definitely want to involve your practice managers in this modelling as well. This is again just one of those collaboration tools to get the conversation started. But yes, the rural loading percentage is on your Pip statement, as is the SWIPI, the standardised whole patient equivalent. So all that information is on your Pip statement. There is a disclaimer there to say that they are estimations. It is not going to be right down to the last dollar, because your SWIPI will change every quarter. So it is an estimator. This is, you can't say, well, ultimately we expect exactly that amount of dollars. It's a guidance tool, not the definitive outcome that you're going to see. Yes, yeah.
So we've got some of our doctors are on salaries and some of them are on percentage.
Yes.
Which way should I go?
Yeah, look, I think that you're going to have to kind of decide that for yourself of where that sits. So the way that the tool works is that the percentage that you put in, regardless of how your doctor gets paid, is based on the percentage of their take on it. Even though they may get 100% and pay a service fee back to the practice, you need to translate that back into, well, what does that mean in terms of a percentage that they receive? And also what you'll see here too, can you see here the GP cost per session is calculated, but you can, you will be able to, it's locked down at the moment, you will be able to include that as an other cost in this little other box here as well. So if you say, well, that doesn't quite work, our doctors get paid a flat fee, and for that session they would get $165. Well, you might actually just pop it into that field there. That hasn't quite translated. I'll make sure that gets fixed up as well. So there are ways that you can that you can translate that across. So there is a fair bit of flexibility in the spreadsheet in terms of how how that can work, but you need to think of how it applies to your particular practice to get the outcome of that. Any other questions about this? Do you like it? Do you hate it? Do you go, yeah, useless? Sorry? Give it a go. So on your agenda, you'll find that the URL is there. There is a little explainer there as well. The video explainer doesn't include the QI Pip component there because that's a recent addition to that. But yeah, feel free to download that and have a play with that.
Are you going to update the APNA one as well?
Yes, yep.
I might have been indisposed in the ladies when you explained that.
I'm sorry?
I might have been indisposed in the ladies when you talked about that at the start, or not?
No. Yeah, so if there are no other questions, I would say have a go at it, have a play, save your different formats, your different types of clinics. On retinal scans, yeah.
Some of the nurses will be trained to do the grading.
Yes.
So we can grade the scan, but then the GP has to sign off on it to get the MBS item number.
Yes.
So they're not overly involved per hour, if you know what I mean?
Yeah.
Waved under their face.
Yes.
So how would I put within that?
Yeah, so within this spreadsheet, that would get introduced into if any of those sort of CDM type of items are applicable. Well, you can use those, but if not,
Like I'll use the 1099.
Yep. Yep.
And then there's 2 MBS item numbers for retinal scan.
Yes, exactly. So you could put your retinal scans in here, and I don't know what your funding is going to look like. And look, and it might be that you just use attendance items. So it might be an item 23 that you put in there.
Regardless of what this is, but this one.
Absolutely, yes, that's exactly right. Yep, that's exactly right. So if there is a GP component, you can put that into those 2 lines. But if there is a nurse-only component that you have some revenue for, whether it's as a block fund or whether it is sort of per service provided, if you charge to patients, then you can certainly. Okay, well, yeah, whatever. So so you can definitely use it, and that's kind of the beauty of it, that it doesn't matter what your clinic is or what its funding is composed of. There is a way that you can incorporate it into this estimation of revenue and expenditure to say, will it work, won't it work, from a financial perspective. And of course there are other considerations too in terms of service provision. Not everything is about the bottom line and the dollar. You may be happy that a service runs at a small deficit, or you may say, well, no, if it's not profitable, then we can't run with it. So again, they are very individual decisions that you need to make. All good? Lovely. Okay, let's close that down. And over to King.